morning. We welcome everybody here and everybody watching. We will go directly to Mr. Aycock for the invocation.
Thank you, Mr. Pate. Let's bow our heads. Dear Heavenly Father, thank you for today. Thank you for the opportunity to sit on this board and for us to make the decisions for the county of Wayne and for the citizens that we represent. We also want to keep Commissioner John Bell, Commissioner Joe Gurley, Commissioner Ray Mayo's families in our prayers, as it's been a difficult time for us this year, and we want to continue to support their families. We ask that you be with our leaders of our state, our nation, that the right decisions are made. Be with our men and women in uniform, the ones that are deployed and the ones here at home, to sacrifice so much for our safety and our freedom. Be with our first responders as they protect us every day, our law enforcement, our fire, EMS, and other first responders that sacrifice so much for us. We ask that you look after our families. And we ask this in your name. Amen.
Amen. Mr. Worrell, pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I trust everybody's had an opportunity to read the minutes. Or are there any corrections? If not, I'll entertain a motion to approve.
Make a motion to approve.
We have a motion on the floor. Is there any discussion? All those in favor, please raise your right hand. Thank you. Mr. Honeycutt.
Thank you, Mr. Chairman. We do have one walk-on we would like to add as consent agenda. This will be item number 12, resolution authorizing the Wayne County Development Alliance to file a formal application for the North Carolina Rural Center Building Reuse Grant Program for $500,000 for the business expansion related to Project Daffodil. And there will be some minor changes to the resolution. 1, 2, 3, 4. In the fifth whereas, I think our attorney wants to reword that to make that a cost not to exceed $100,000 and up to $100,000. And we would like to authorize him and to make those changes, but we would like to add that to consent.
Okay. Do the commissioners have anything they want to add to the agenda? If not, I entertain a motion to approve the agenda as it stands.
Motion to approve.
Thank you, sir. We have a motion on the floor. Any discussion? All those in favor, please raise your right hand. Thank you. Mr. Aycock, I'll turn it over to you for the appointment committee.
Yes, sir, Mr. Pate. We have 3 that we need to vote on today that was recommended at the last meeting. The first one is the appointment committee recommends the appointment of Jessica Taylor to the Community Child Fatality Prevention Team, and that's in form of a motion.
All right, we have a motion on the floor. Is there a motion to approve?
Motion to approve.
We have a motion. Any discussion? All those in favor, please raise your right hand. Thank you.
The next one, Mr. Pate, the appointment committee recommends the appointment of Charles Brown to the Wayne County Public Library Board of Advisors, and that's in form of a motion.
All right, we have a motion on the floor. Any discussion? All those in favor, please raise your right hand. Thank you.
And the last one for today, the appointment committee would like to recommend the appointment of Demarcus Reid to the Goldberg Planning Commission, and that's in form of a motion.
Motion on the floor. Any discussion? All those in favor, please raise your right hand. Thank you.
And for the next meeting, the appointment committee would like to present the following recommendation to the to consider voting on November the 10th meeting, the reappointment of Frida Brock to the Nursing Home Advisory Committee, and we'll vote on that at the next meeting.
Thank you, Mr. Aycock.
Thank you.
We discussed the consent agenda at length in our earlier meeting. Is there any discussion or anything to be added to that? All right, I entertain a motion for the consent agenda.
So moved.
Motion on the floor, any discussion? All those in favor, please raise your right hand. Moving on to new business, I'll turn that over to you, Mr. Honeycutt.
Thank you, Mr. Pay. We would like to recommend a schedule in working with Borden and Andrew for the replacement of Commissioner and Chairman Ray Mayo. This is a very similar schedule. Unfortunately, this is the third time we've had to do it, but it's a very similar schedule that we did for the replacement of John Bell and for Commissioner Joe Gurley. So with the board's approval, October 20th, which is today, you will adopt the schedule. October 30th will be the last day to receive applications. So if anybody is interested to have their applications in to the town or county clerk by 5 p.m. on the 30th. Then November 10th, and again, we will be recessing this meeting and reconvening the meeting on November 10th. You will do interviews with those candidates beginning at 1 p.m. And then on November 17th, which will be our next regularly scheduled meeting, you will make a motion to approve that vacancy.
I would like to add that if you get any questions, there is no actual application. It's a matter of turning in a resume and a cover letter to my email address, but there's no actual application. Because I do get that question a lot.
Is this out on our website?
It will be once approved.
Okay.
It will be once approved.
Do we need a motion on this, or?
Yes, sir, we do.
I make a motion, we adopt the schedule
All
as
right.
presented.
We have a motion on the floor. Any discussion? All those in favor, please raise your right hand. It's passed. Okay.
All right.
The next one, we'll have them come up this time.
That's right. We'll have, next is a motion to approve Ceres Environmental as the primary contract for debris removal services and Ashbridge Environmental as a secondary contractor for debris removal services. And I will turn this over to Aaron Stryker, who is our emergency management director, and also Brian Taylor, and also Noel Woods, who is our purchasing director.
Good morning, gentlemen. So as County Manager said, this is for debris removal services and debris monitoring. This would be used in case of a large-scale natural disaster that produces not just vegetative debris, but also construction debris. So we'll have one company, Ceres, will be the primary contractor. Once we have the event go through, we would call them. They would come in. There's two phases to it. The first one is a 70-hour initial phase where they're just clearing roadways. Where they're just clearing roadways, and then the next phase would be actually getting the debris off the roads, and then to disposal sites. The monitoring company, the monitoring company is there to make sure the removal company is doing their job. And then on the county side, either myself or Randy Rogers from Solid Waste that keeps an eye on the monitoring company and receives those reports that will then come to the Emergency Operations Center in case there's any questions. The contracts that we have for this one is a 5-year contract. So we're hoping that once this is all said and done, it'll get put up on the shelf, collect dust, and we won't see it again until another 5 years when we need to renew it.
We've done this in the past, haven't we?
Yes, sir.
I thought we had. Guess we need a motion on that.
Just to be clear, this does not involve the stream cleanout.
No.
No, this is, we're looking at roadways and making sure those are put in place to keep those clear, sir.
This is just for future storms if we have them, and
Yes, sir.
afraid that we don't. But this is just primarily to have somebody in place to start immediately clearing the roads.
Yes, sir.
And Aaron, correct me if I'm wrong, FEMA requires that we go through this process and we have the contracts in place in case there is a national disaster. So this will be able to be
Yes,
reimbursed
this is a reimbursable
back
cost.
to the county because we have got the contracts in place and we've gone through the process.
You need a motion?
Yes, I do.
Make a motion, we approve this.
I have a motion on the floor. Is there any discussion? All those in favor, please raise your right hand. And I'll just say this because Joe's not here. She got to hire somebody to watch, somebody to do their job. Because I know that's what he said he was here.
There's not enough people at the county level to,
I got you.
Joe watch
I
it,
got
sir.
you. All right, moving on to the debris tech.
oh, sorry.
And then motion to approve Debris Tech as monitoring firm for debris monitoring services.
So we need a motion on that.
So moved.
Got a motion on the floor. Any discussion? All those in favor, please raise your right hand. We done.
All right.
County manager report.
Thank you, Mr. Chairman. Wanted to mention, to remind the board and the public as well, tomorrow at 11 a.m., we do have an announcement with respect to education and economic development that will be at the Fremont Town Hall beginning at 11 a.m. So tomorrow will be a good day for the town of Fremont. So we're excited for them, excited for the northern part of the county, and it's hopefully the start of really some good things moving forward.
Great.
So we do have that at 11 tomorrow at the Fremont Town Hall. One thing I did want to mention as well, I do want to give a huge thanks to our Maxwell Center staff. Again, 2 weeks ago today, we buried Commissioner Mayo, and they did an excellent job with respect to the setup and working with the funeral home. And I thought it was a wonderful tribute that the county did for Ray. And wanted to thank y'all for attending as well. But I did want to give a special thanks for the staff at the Maxwell Center. It was really done well. And I think Ray would have been very proud. So very happy that that turned out as well as it did. One thing I do want to talk about a little bit today is we do have our health director here, Dr. Brenda Weiss. I always said that wrong. Is it Weiss or Weiss?
Weiss.
Weiss. I'm so sorry, Brenda. But we've received notice that our numbers are going up. Our COVID numbers are going up here in Wayne County. And we're starting to do some different things. We're going to be working with public affairs. We're going to be working with emergency management about how we can do things that will hopefully have an impact on the numbers. Because we really have to do some things really right now to get to the hearts and minds of our public and letting them know that we're not out of the woods, that this thing is still moving forward and that our numbers are going up. So with that being said, I want to first introduce Brenda, and then after that have Joel Gilley, who will talk about some public affairs things that we're going to try to do as well.
All right, so thank you, Craig, for inviting me. A little bit of a follow-up for our last conversation about COVID. What I wanted to start with is a follow-up on what Craig mentioned. These are our updated county statistics. And so remember we talked about, like, we in public health look at indicators of spread, and these tell us how well we're doing at controlling and mitigating the virus. And so our positivity rate, that is the number of positive tests we receive over the number of people that we tested. That's what that equals. Well, last time I reported to you a few weeks ago, we were under 4%, which was pretty good, and certainly less than the state at that time. Unfortunately, recently we've had an uptick. You can see on the orange bar, each bar is a week, and the little line with the bullets in it is our positivity rate. So we've upticked a little in the last 2 weeks, and we're now at 6.2. And honestly, I expect that to actually be higher this week as well. The state's running 5.7, so they're upticking also. Now, this is across the state, and I'll follow on what Craig mentioned in a minute, but we're seeing it actually nationally. We're seeing this uptick in the number of positive cases. Our death rate, it was 1.8. It's still 1.8. I just rounded it up to 2. But the state is 1.5. So we're still, again, trending above the state. We've always been below the state, and now we're kind of jumping up. Our last indicator is our healthcare capacity. This information comes from UNC Wayne, and they are also reporting increased numbers of utilization of the hospital, the emergency room, and the ventilators. And they predict in the next 2 weeks, those numbers are also going to continue to rise. So this week, the little dashboard up there that Joel produces for the county, we're actually at 4,000 new cases, not 3,773 as of yesterday. And just so you know, our age group 25 to 49 still represents almost half of our cases, and that the young 0 to 17 is our lowest category. So that part hasn't really changed very much. It's just the overall number of cases. We used to have about 13 to 15 new cases a day, and now we're trending 25 to 30. And that is a big difference, right? So with each new positive case, there's a probability that they could end up utilizing the hospital. So therefore, the hospital numbers go up. And inevitably, when the positive cases go up, the deaths will go up. That's a lagging indicator, we call it. So all of this is moving in a direction that's not that I reported a few weeks ago, and in a direction that us and the state want to kind of curb a little bit. So next slide. So the top portion of the slide, I want to show you, this is a state graph, and what it shows is they have on their website now what they consider clusters. So what's a cluster? It's more than 5 positive cases that are all linked in some way. In other words, one person caused another person to be positive, caused another person to be positive. So they've all been associated with one another. So we call that linked, and that makes a cluster when there's 5 or more. Right now, this graph shows the clusters in our congregate settings like schools. So we have 2 at least in our schools, and our school now has a dashboard of their own data, which is super great because we do track the schools and the businesses and everything that's congregate, and it's a big heavy lift. It's probably 100 different organizations that we try to track, but the school now has their own dashboard, so you can go up there and see where their cases are trending across their schools, which I think is really good for them to get out in front of that. We also are seeing clusters in businesses in agriculture and other congregate settings like faith-based organizations. Okay, so now the bottom half of the slide. Dr. Mandy Cohen invited the top 24 counties, the county manager, the health director, and the Board of Health chair to have a conversation. So we're probably out of the top 24, the highest positivity, we're probably about 16, 15. Lower half, but on the list, okay? Not top 10. But we're trending in the wrong direction, and this is why she wanted to have a conversation. And so what she wanted to do is work with us to figure out how do we reach people and touch their hearts and minds. So I'm going to explain what that means. So we talk a lot about testing. We want to test, and we want to test, and we want to contact trace, and we want to do all this follow-up work, right? We are not going to be able to test and contact trace our way out of this shift. We're not. And the reason why I say that is this. Every positive case that we have, the health department or United Way has to follow up on. We call the case, hey, how's it going? Who are you in contact with? We call those people they were in contact with. And I cannot tell you how forthcoming people are to say, I'm supposed to be in isolation and quarantine, and I had a sleepover. My parents had a party. I went to the movies. They recognize the importance of isolation and quarantine, and they're just not doing it. And they're very forthcoming to say, I had a sleepover with 5 other kids. Well, guess what? 2 days later, the 5 other kids are now positive. So when we follow up on positive cases, that's a good thing, and it's a good thing to test. And it's a good thing to find out who they were in contact with, because that's how we could control the spread. But if people don't do the right thing, we're never going to be able to control the spread. And that's what Dr. Cohen was trying to address. You know, there's one thing, we know how to prevent more spread, the mask, the social distancing, and avoiding mass gatherings. The mass gatherings are what's driving the bus right now. You go to a mass gathering, listen, I have a humongous family. I have 13 brothers and sisters, and I keep telling them, don't come visit me, because there's like 6 of us here in North Carolina. Please don't come. My brother wants to come from Colorado. My sister wants to come from Florida. Don't come, because I don't want to have another family gathering with you. Because I'm afraid that if you bring something to me, we're all going to get it. Because mass gatherings is where a lot of this is happening, okay? Churches, businesses, things like that. So our job now, according to Dr. Cohen, is try to reach the hearts and minds of people, change their behavior. They know what to do. We told them. We call them. We remind them. They're burned out. They're tired. They're over it. They want to get back to work. They want to get back to life. And golly, I share that, and we all do. I mean, these masks are awful, right? We know that. But we're not going to change that trend with testing and contact tracing unless people change their hearts and minds. So I think that's the conversation we need to have, is what strategies can we do to promote behavior change, which is a really hard thing to change, right? So that's one aspect of the two-legged attack, prongs of attack that Dr. Cohen addressed. The second one was enforcement. Now, we don't really have the health department enforcement capability. We can tell people, here are the guidelines, you should really follow them. But yet and still, at the end of the day, we all have police powers. We could shut things down if I felt it was an imminent hazard. You could pass an ordinance at the county level, which we're not recommending, unless you decide you want to do that, to create some enforcement arm. The Board of Health could pass a regulation to do enforcement. So let's say a business is open, they're not operating properly, we fine them. We shut them down. This is not what we want to do. This is absolutely not what we want to do. What we want to do is change the hearts and minds, right? Because that seems like a whole less disruptive to our economy and to our people than it is to go doing enforcement. We want to incentivize rather than penalize. So I'm going to stop there and let Craig lead the discussion, unless there's any questions, right, from me.
Is there any, and again, I don't want anybody to think we're recommending looking at any enforcement at this time. It is really, we wanted to make people understand the importance of it, that our numbers are going in the wrong way, and that we still, as Brenda said, we're very tired of this. We're very tired of hearing about it, but it's here, and our numbers are going in the wrong way. And one of the things we're going to meet as staff to talk about winning hearts and minds is how we can get out in the community and better give our message out and be consistent with the messaging of the wear, wait, and wash. Joel, would you mind coming? Oh, hey, Joel.
Yeah. Can I give one last comment?
Yeah,
so I think it's really important, too, to understand that when we test, which is good, we all want to encourage testing. I'm doing it twice a day outside my building, probably testing over 200 people a week, which is quite a bit. Testing them is just really the first step. That's pretty easy, in fact. But I do have to spend a lot of staff time manning those things. Even with the United Way helping us, with 25, 30 new cases a day that have to be contacted through the entire 14 days of their isolation quarantine every day, right, and follow up with them, the amount of staff time it takes to do both what United Way does, and I probably do twice as much, my staff, to do that work, to report all the data in 2 different data systems, to call them up every day, to follow up with them, to make sure they're okay, to report the clusters with the state, to have these conversations with the state, right? At the end of the day, the state has provided the county, including my department, some COVID funding. It's not even close to cover my staff time to do this work. So yes, we want to do everything that's right, but we got to change those hearts and minds, because I'm running in a deficit starting in January. I'm going to be running in a deficit for a while that the state isn't going to cover, because if I don't bill for services, I don't get paid, my staff. I don't want to let staff go. So you can see we're really in this place where I'm very nervous about how we're going to do if we don't sort of work on some of these hearts and minds activities. But I wanted to share that because I think people think health department staff are free. They're really not. There's very little discretionary money for me to cover the staff salaries to do the follow-up COVID work, because I don't have a source of funding for it that covers all of it. So I just wanted to share that. Thanks, Joel.
Good morning, Commissioners. As Craig said, we're going to be meeting with the Health Department team and the management staff to figure out how we can help change those hearts and minds a little bit. Did want to update you guys on mask giveaways and what we're doing to kind of get masks out in the public more. So we've done a few mask giveaways. Turnout was okay, but we really wanted to reach more areas where people could come outside of business hours, places in the community that people could come. So we are giving masks away at the Health Department testing site, so anyone who gets tested can get masks for them and their family as well. Annie with the Board of Elections has agreed to help us get masks out to all the early voting sites. So those were dropped off and should be distributed to all those sites because, you know, they are very well spread around the county. as well as all the public libraries. So they're getting those distributed because just about every municipality has a library somewhat close that they are in. And those facilities are open outside of normal business hours. People are used to going to those areas as well. And then one of the things that we're pivoting in our department is changing some of our digital advertising methods and our radio partnerships to really start hammering home those hearts and mind campaigns. DHHS has a great campaign right now called Get Behind the Mask. And whether you get behind the mask for your parents, your grandparents, your friends, your neighbors, just get behind the mask. And we're also looking to do a more localized version of a campaign as well to hopefully change some hearts and minds and get this positivity rate down just a little bit. So that's all I have. Any questions?
Any questions for Joel or Brenda that we can ask? And again, I think we have done a good job to this point, but with the numbers going up, we're going to start being a little bit more aggressive, and especially our marketing side and getting the message out. So I appreciate the work that Joel and the health department, Aaron with emergency management, it really has been a team effort to move this forward.
And it's true what she said about the hospitalization. We were told last week at our hospital board meeting that the numbers had doubled.
Yeah, I think yesterday was 27, which was one of the highest.
Yeah.
It's been going up. It was 22, I think, when we were there the other day.
Yeah.
Because they thought it was, going down, but
They
it's.
actually predicted the next 2 weeks is going to be much
Well, the
higher,
guy from
so.
UNC, that's exactly what he said. They
Time's down.
expected a spike. So,
This is for the director. On your chart, and the bullets you have, yes, ma'am, you have the school system.
Oh, the next one you mean?
Well, that was the one, that one.
That one? All right.
The school system ranks as the first bullet. Now, sometimes when I'm writing something, the first bullet is the most important of all the bullets, and which means the highest level of concentration, the most likely that something is going to be impacted by that bullet. So the question is, based on your sequential, does the school system rank as the number one positive producer at this time?
I really like the question, and I think the answer is it's nuanced. So
It's what?
It's nuanced. It's not.
Is
Yeah.
that yes
so
or no?
It's fluid. So anyway, so the schools are a place where there could be transmission, right? The two schools that represent these two clusters actually are very, very proactive about taking all the right precautions. And we met with the state on both of those two schools. We met with the Mandy Cohen staff and the school to discuss what's going on. And what we found is that while the school was closed, both of them, most of the spread happened because the kids were going, while they were in isolation and quarantine, to parties, music festivals, sleepovers, the whole thing, the entire time they were supposed to be in isolation and quarantine. So the school, it gets reported to the school because they're all students or staff.
So they get it and bring it back to the school where there's a gathering.
Yes, but they're mostly spreading it in their community, in their relationships, in their neighborhoods, in their friends, in their churches. They're not necessarily spreading it while in school. There is a little bit of spread in the school, but most of the spread is happening on these other events. And that's what we discovered with these two schools. And those other two bullets are just as important because those congregate settings are where most of the spread is happening for the exact same reasons.
So
Either you can't isolate or you can't wear a mask or
So the business, okay, so now you're active with the schools and you're interacting with them about the growth of the problems there and
Yes.
the fact that the children are leaving and going to sleepovers and so forth and so on. Let's go to the businesses.
Yep.
And you say agriculture cases. This is a two-point question. The businesses, I guess, are general, but when you say agriculture, are you talking about field gathering or are you talking about the food processing
both.
establishments, ma'am?
Both.
Which is the higher of the two?
It's hard for me to say because a lot of those businesses that are nearby bridge more than one county. So it's not just our county, it'd be like us in Lenore or us and someone else. So our numbers are still, for our residents that work in those businesses, we try to track that and separate it out. But the business as a whole spans more than one county. So that's why sometimes the businesses, and same with agriculture.
How desperate will the situation get before your Department of Health will flag an area as being a hotspot?
5 or more cases, that's a state definition.
And when I say that we may be talking about two things in terms of flagging it to you might be putting it on a chart. Flagging it to me is putting some kind of indication so the public can see that that is a hot spot.
Yes.
And I may be out on the extreme, ma'am, and I don't mind being out there. I'm talking about putting up some kind of a sign that says this is a likely COVID-19 hotspot.
So to that point, that graph from the state is what they're trying to do. So they started this probably, I want to say last week. So they didn't do the historical cases we had at some of the businesses here. They didn't put the older clusters up there. This is like moving forward. So every time we have a school or a business in our county, it's going to count on that graph. This is the state's version of it.
For the public to know it, they would have to see your graph.
They would have to see that graph.
Ma'am, I don't want to be.
Well, we've had a few news articles put out by different
All
places
right.
also.
I'm talking about, right this minute, people who want to get elected are putting their signs out beside the street. So people see those.
Yeah.
Average person who's going up and down 11770 or whatever is not going to likely read a graph. They're not likely going to read the newspaper because there's not a real good newspaper out there right now. And who gets the newspaper, so how are they going to know? If there's a problem someplace, ma'am, and we're heading in a upward trend and we don't know where that trend is going to end, then let's not be, as a body, reluctant to notify the public. And I mean a sign. I don't mean playing with this thing, ma'am. I mean putting something that the public can indicate that whether it's a school or business or whatever it is, this is a place where there are numerous cases, and if you stop in there, there's a likelihood that you're going to be in that environment. Pure and simple.
Point taken.
I move
And maybe
on.
on our Hearts and Minds campaign, where'd Joel go? On our Hearts and Minds campaign, we'll add this to the list. Let's explore that tomorrow.
Yes, ma'am, and I move on just a little bit further.
Yeah.
Because you do notify, if Restaurant X was having a problem, you will notify them.
Oh, we work with them very closely,
And,
yes.
right. But the persons who are running the restaurant would not know it maybe unless you inform them that some cases that come in, and I know these people work at your restaurant and or have visited your restaurant, so we're giving you a red flag.
Well, no, there's actually 2 ways. We will notify the business, or a lot of times the employees will notify their employer. That happens a lot.
But the employer may be the last to know.
I can't say
Well,
the
I mean,
sequence,
if the
yeah.
person gets sick, comes to you or to the hospital, you quote them, or where do you work at? They tell you. At that point, you know where they work, and then you notify the company.
And if there's a cluster,
So
if
this
there's
is
more
my
than
last-
5, there's a
this is-
process with the state that we open up an investigation.
This is my last slide on knuckleball or fastball. This is the last
All
one.
right, here it comes.
So I'm a property owner, renting
Yes, sir.
property to people. So a person comes to you and's got it. You say, well, where do you live? They tell you. Do you have an obligation to call the property owner and say, wait, you're shaking your head no already?
No, that's not even legal.
Well, was it legal for you to call the school and let them know it? Or was it legal for you to call the business and let them know it? Because I think I just heard you say.
Right, if
that-
there's
well,
5
let
or
me
more
fin- let me finish with
cases.
the question.
Yep, there's 5 more cases, yes.
I think, based upon the earlier conversation, was that it was legal for you to notify the school. It was legal for you to notify Restaurant X. Is that yes or no?
If there's 5 more cases, yes,
If it's 5 or more cases.
correct. Because we open what's called an outbreak with the state, and then the state
But
assists
you
us.
don't notify them if there's only one.
Pardon me?
You don't notify Restaurant X if there's only one?
No, we may call them if there's like 2.
You may call them.
No, let me
So there's a
finish.
case
There's a
where you-
process. We have to
Well-
follow the process. So if there's like 2, we might call the restaurant and say, hey, we've noticed there's a couple of cases.
But you wouldn't call if it was one.
Probably not. No, there's too
But
many.
you have called if it was one.
We
That's
have,
just a
but
yes or no,
with
man.
4,000 cases right now, we have active probably 300 cases a day.
And so you haven't called a restaurant that had only one case of an employee showing up, they had it.
We did early on, and we just
But-
don't have the staff right now.
All right, okay, all right. I just want to get to where you said we're gonna up in the ante. So if
Right.
it takes more personnel to do this, Mr. County Manager, let's not be reluctant to do what it takes to get notification. Because this is, wait. This is where I'm going with this.
Yes, sir.
If a restaurant owner, the school, or any other entity out there has a right to know if there's an active case in their environment, as a property owner renting property to people who, some of them are working at these businesses and agricultural establishments we're talking about, and going to the schools, you telling me I do not have a right to know? Is that
Well,
yes or no?
So there's a trade-off, I think, with, I understand what you're saying. And actually, when we always want to prevent spread, so I think you're addressing preventing spread. But people also have privacy rights under HIPAA, and so I couldn't call a property owner and say, John Doe in your property, because I can't give away John Doe's identity. I could say there's someone in your building,
Right there, ma'am. You hit it. I
but
don't
if
want
there's
to know
only
the
2
name.
people in the
I don't
building,
want
maybe
to
his
know the
property,
name.
it's a trade-off between privacy and
And let's
transparency.
split this here just where it benefit. I don't want to know the person's name. I want to know the building. I want to know the address. And then I contact you and say, look, what are y'all doing about it? Or I know not to go there.
True.
You see, ma'am,
I
it's
hear
about
you.
information. And it's about information that at this stage of the game, it's information everyone needs to know. And I understand the HIPAA laws. I read them. I worked in the school system, so you know I'm familiar with HIPAA. My point is, if you can notify anyone, then everyone that has a potential to be affected deserves to know. And I need to. There's nothing I can personally do about it. But you know, I'm not one to let something just not let it die. My manager knows. My colleagues know that. I talked about Medicaid for 3 or 4 years, seemed like, until I just got tired of it. But I just don't believe in letting something lay down. I just want you to think about what's good for one is good for another. Information good for one group is good for another one.
Right, and I think it does really, as I pointed out with every positive case, we have United Way, who got another contract with Cure America, in addition to our contract, to help us, but they still only carry about a quarter of the work that gets done, and none of my work is reimbursable. So,
Yes.
yeah, so what I'm trying to tell you is I just physically don't have the, I don't even have the resources to cover what I do now.
All right, just stop. Let me stop. Please bear with me. Let me ask you to stop there just a moment. What dollar figure does it take? How many people are we talking about? How many people would make a difference? 20?
I don't know. That's a good question.
10 would be a good start? 5? My point is this. If we can, and I'm not being, I hope I'm not stepped on, if we can speculate on buying buildings and other things that's forwardly projected for the county, things that we do, things that we spend money, things that we vote on up here to do with money, this is as important as anything that we have ever done or even ever considered. If you need some more people, ma'am, I would appreciate you coming up with that number and let our county manager know very soon so that he can let us know what that figure is. Because I'll be bringing a resolution to this board for whatever that dollar figure is. Okay? Now,
Yes, sir.
and leadership about these masks start at the top. I'll just leave it at that. Leadership with the masks start at the top. It's not a do-all. It's not perfect, but it helps out. But if it's people that we need to help to notify people or to get something done, I don't want us to sit on our hands and say, oh, well, this costs too much. There's no such thing as it costing too much when we're in the grave. Can't take any of this stuff with us. Mr. Chairman.
Yeah. Yeah, I think, I agree with Mr. Kamadi has said. As a county, I do feel that now we're all behind the eight ball because for many months we said and expressed how we feel about COVID-19 spread in this county due to the fact that the numbers were less than 4%. I think that's what it was the last presentation. We kind of used that as, okay, we're fine, and kind of let our guards down. But at the same time, as a county, we're behind the eight ball. And of course, Mr. Kamadi, you know, he's very passionate about what he's saying as well as I am. But when you talk about the school system, the clusters are being 5 cases or more, that's when you kind of alert the school system. No, I think it should be, if one person is affected at any school, all of us should know. We should know that. Because if I had kids in that school, I would want to know that, okay? So as a whole, we need to get to grips with this as a county and be more proactive. Look at your schedule to hire more people of what it would take. And of course, if there's a massive outbreak, we know that your number that you come up with may not be enough, but we need a number of staff to support this ongoing.
Thank you.
Thank you very much.
Thank you, sir.
Thank you, Doctor.
And I did want to mention one of the positive things that Dr. Cohen did say on the call was schools, and Brenda, correct me if I'm wrong, schools were going better than they expected at this point. You know, the openings of the schools, so that they were not looking at making major changes. I think dealing with the schools individually when those clusters came up, that and going back to Plan C instead of Plan B or A. But she was very pleased. Is that fair? She was very pleased at the way the schools have opened and are operating right now. Not saying that something may change today, but on the phone call that we had, that's gone as well as can be expected. So, did you want to?
I think it was more what she emphasized is when you get out in the community and you have a party or you go to a mass gathering, whatever type it is, that's where most of the spread is happening. It's not really at the school. People are bringing it into the school and they are sharing a little bit of the illness there at school, but most of it is in your personal choices that you make every day. And that's the Hearts and Minds campaign, personal choice.
And I think the other thing that really, when she was talking, was especially in the fall and the cooler months, you know, before we were outside and you could do a lot of social distancing outside. Now a lot of events are going to happen indoors, and that was a concern as well. So with flu season as well. So to you know, think about those things as we move forward as well.
Absolutely.
Okay. And that's all I have, Mr. Chair. Oh, I did want to mention one thing. We have been notified that we've received the Certificate of Achievement for Excellence in Financial Reporting that's been awarded to our Wayne County Finance Department for the last 24 years in a row. Once we get the award in, we will do a formal presentation to our Finance Department. But they've done just an excellent job and a lot to be proud of. But we will make a big deal with everybody and make a presentation once the award comes in. So we're just very excited for them. So just
Well, I was
wanted
going
to
to
mention
congratulate her, but I don't see she's not in
that. She was getting a mask, I think. So.
All right, going on to Commissioner's reports. I'll start with you, Mr. Freeman.
Basically, I'd like to thank Craig and his staff, also the planning board, for getting back to me with some information I needed for some residents recently. Also, I attended the I-40 meeting, had that this past week. Everything's moving along.
I don't think I have anything.
Talk loud.
The what meeting? I'm sorry.
Good job.
I-40.
Swerve.
No, I'm good.
You too? Yeah. Mr. Aycock.
Just a couple of things. Did a walkthrough on the new 911 center Friday, and we're a whole lot closer than we have been. Very few things that we pointed out that probably need to be addressed, but very very pleased with the progress at the 911 center. And also, as everyone knows, early voting has started. We were kind of caught off guard about using the Maxwell Center as a voting place or polling place. Probably one of the best things happened to us. I've talked to right many people that had never been in the building, had no reason to go in the building, and I have not had the first negative comment yet on the Maxwell Center on people going in. They haven't seen the whole thing, but to have the opportunity to go in to vote, and so many positive comments on they didn't realize what a jewel that it was. And basically, that's all I have, Mr. Pate.
And I will echo that because when I was out there, the number of people I saw that said the very same thing to me. Said, I'd never been in this place before. I said, it's really nice. And they said, we never had no idea it was like it was.
Yeah.
So it was money well spent for this community. And I want to thank the Maxwell Center employees for getting that ready. And I know they're short-staffed right now, too. And the Board of Elections is doing a great job. I was there Sunday. I got there about 20, quarter till noon. I was probably 50th in line. And once they opened that doors, I was in and out of that building, voted, and back in my truck in 20 minutes. And I expected it to be a lot longer, and it was getting hot out there, too. They've been doing an excellent job. They've got their routine now pat. Of course, I know the other sites don't have the number of voting booths in there, so I can't move quite as quickly. But I would encourage people to go there. And from what I've seen, the voting has been very, very heavy. Of course, I haven't been over the pipe, I haven't been to Mount Olive, but when they're wrapped around from the door all the way around the building, you got some heavy voting going on. I'm glad to see that.
I would only like to piggyback on something that Mr. Pate he said about the center. And I'm getting into the short rules of my relationship with the board. So we won't leave anything to chance. When we ventured into this whole arena of a center, it had for people who've been in Wayne County for 20, 25 years or who may have been here permanent, they know that there have been all kinds of discussions and possible sites and about some kind of a convention center or something. There's been a war back and forth on that. But this board stepped forward with a lot of insistence from different people. Mr. Pate interacted with the farmers a lot, and others of us interacted with people in our communities and so forth and so on. But people still have a tendency to say, well, why are you doing that? Why do we need this kind of thing? I would only like to speak specifically to two groups that I'm maybe a little bit more familiar with. Church groups who have had an opportunity to have some things out there. We were having a birthday party for my daughter, for my granddaughter out there, and one of the biggest assemblies of a church that I've probably been near was across the hallway in another part of the building. It was a large group. We did fine. The teenagers did their thing on this side of the hallway, and the church did their thing on the other side of the hallway. And the sororities and fraternities that are using that building. And in the past, before the Maxwell Center was put up there, for that kind of a setting, everyone had to try to book Goldberg Country Club or maybe Walnut Creek. But this is a public building that is second to none. This is what's truly a public building, second to none. And I just want to, as a parting, thank this board right here, the group, this 8 years of what I call this board group, for working on that, pushing it through, getting it done. Wayne County has a quality site, but it'll be there. And that's saying something real good for what has happened here.
And I was told by many of the public, have you lost your mind? I said, no. They asked me if I'd lost my mind.
Oh, yeah.
I said, now you got to have the vision, folks. You got to have the vision. Yeah. Question, and speaking of the 911 center, when are we going to be able to do that?
We had that canceled because of We will try to do that the meeting in November.
Okay, I just wanted,
Yeah,
like,
we'll make sure that that gets taken.
like Ed, I want to be there before
Yes, sir.
before I'm gone.
One last thing, and just as an update for the members of the board and other staff who may not have been in the neighborhood lately. The Southern Wayne Basketball Complex Center, it is, the principal told me last week that sometime by this week he'd give me a walkthrough if I had a moment to walk through it. So it's in the short rows, beautiful building from the outside, but I expect no less on the inside. And just to once again thank the board members who are with us here and the ones that are in heaven. If we hadn't all locked hands and moved forward, then that place would not be down there. And it got to be a little pricey, but that will be there for the next 50 or 75 years. And I would just want to thank this board for supporting Southern Wayne County, supporting my desire to make sure it was there. And just to say that out loud, thank this board, Mr. Acock and everybody. This 8 years of us working together made it happen.
Mr. Pate,
Yes, sir.
since Mr. Camardi brought that up, I want to clarify something. There's word on the street now that someone else is taking the credit for getting that money for that gym. And I want to make it very clear to everybody, Ed Camardi was the driving force behind that gymnasium being built. You know, and if it takes somebody else off, that's fine. But we all know that Ed Camardi was the driving force from getting that gym built at Southern Wayne. Thank you.
He did remind us quite often. All right, is there anything else to come before this board today? I say that we're adjourned. I'm sorry, recessed until November 10th.
At 1 p.m.
1 p.m. Thank you.